Katusoks, I'm Leslie Hart-Fajardo, the Internal Secretary of the Student Alliance of Medical Technology, and welcome to the SEMT's Beginner's Guide to Phlebotomy 101. As students ourselves, alam namin na mas madaling maintindihan ang laboratory practices kapag nakikita ang actual presentation. We prepared the step-by-step Venipuncture demonstration video in hopes na makakatulong ito sa face-to-face classes and internship natin. Tara, simulan na natin! The first thing you need to remember about every medical technology laboratory practice is that the test process always starts with a test request from the physician. The first step to this venipuncture procedure is to review and access the test request. This is done for 3 simple reasons. 1. To avoid the duplication of the test request. 2. To ensure proper collection timing. And lastly, to identify the special instructions or equipment required for the test. Kapag titingnan na ang test request, ang kailangan nating makita ay una, kung kumpleto ba ang required information, such as the requesting physician's name, the patient's full name including the middle initial, and the patient's birth date and age. Ikalawa, kailangan din nating i-check kung nakalagay ba ang type of test requested at pati na rin ang time and date of collection nito. Ikatlo, check for any dietary restrictions or latex sensitivity, or any special precautions to be followed. And lastly, determine the test status. The second step of the venipuncture procedure is to approach, identify, and prepare the patient. And yes, kahit pa-lab people tayo, kailangan natin ng communication skills kasi kakausapin natin ang patient primarily to confirm their identity. Remember, the misidentification of a patient and the mislabeling of a specimen is a very big no-no to our field. For the third step, we need to verify the patient's dietary restrictions and latex sensitivity. Siguraduhin latex-free equipment ang gagamitin sa patient and walang latex items sa room kung ito man ay allergic sa latex. Step 4. Observe proper hand hygiene and sanitize your hands. Step 5. Make sure that the patient is seated on a blood-drawing chair or reclined if they are prone to fainting. Make sure that the patient's hand or arm is well supported. Then, apply the tourniquet 3 to 4 inches from the intended site, and if the patient has sensitive skin, apply it over a gauze. Never apply a tourniquet over an open sore because it is our job to aid the recovery process of the patient and not cause them any more harm. Kapag nailagay ng tourniquet, ask the patient to clench their fist. For step 6, decide which site to puncture. Ang preferred venipuncture site is the antecubital area of the arm. Next, gauge the size of the vein by rolling your fingers side by side and gently press on the site to check its depth and patency. Pagkatapos nito, alisin ang tourniquet and ask the patient to open their fist. Step 7 is to clean the site using an antiseptic, covering about 2 to 3 inches of diameter using a circular motion, and allow the site to air dry for about a minute. Step 8 is to prepare the equipment and put on gloves. In this video, we will be doing the venipuncture procedure using the syringe system, so it is very important to select the appropriate syringe and needle. Open the package aseptically and securely attach the needle to the syringe, and then you have to test the plunger. Step 9. Reapply the tourniquet without touching the cleaned area. Reach for the collection equipment with your dominant hand to uncap and inspect the needle. Tandaan, kailangan sterile ang needle so it must not come into contact with anything prior to venipuncture. Replace it with a new one if it does. Step 10. Ask the patient to remake a fist and hold their arm with your free hand to anchor the antecubital vein. Then, insert the needle with the bevel facing up using a smooth forward motion in a 30-degree angle. Then, fill the syringe with the required volume. Step 11. Place a cotton ball over the site of needle insertion and then cover it with a micropore tape. Dahan-dahan alisin ang needle and activate its safety feature kung meron. Step 12. Discard the collection unit and label the tubes. The necessary information is as follows. The patient's full name including the middle initial, birth date, and if applicable, the patient's ID number. Kailangan din ilagay ang date and time of collection, initials ng phlebotomist, and additional information halimbawa kung fasting specimen ang kinuha, indicate na fasting. Kung matatandaan nyo ay kanina, bago magsimula, ni-review natin ang test request. Isa sa mga dahilan ng pag-review noon is to check if there are special handling instructions requested. After labeling the tubes, observe the special handling instructions if there are any requested. Step 14. Dispose of the contaminated materials. Siguraduhin sa tamang container ilalagay ang mga materials. Halimbawa, sa sharps container itatapon ang ating used needle. And after the venipuncture procedure, it is important to thank the patient. Remove your gloves and resanitize your hands afterwards. And the very last step of the venipuncture procedure is to transport the specimen to the lab, kung hiwalay man ang laboratory sa blood collection site. And that's all mga katusoks. Of course, this procedure is hard to perfect upon your first attempt. So lagi lang tatandaan, practice makes perfect. I wish you learned something from this step-by-step venipuncture demonstration video and I wish you good luck on your endeavors. Ｐадайоｎ, future RMTs!